The trauma bay doors slammed open at 11:47 p.m., and four soldiers in full dress uniforms stormed into Harlow General Hospital like they owned every inch of it. Behind them walked a man whose chest carried more medals than most people see in a lifetime. General Raymond Stokes, 4 stars, Army Chief of Staff, and his eyes were burning with something that had nothing to do with military composure. His daughter was on a gurney. His daughter was dying. And the first words out of his mouth weren't a greeting or a question. They were a demand that hit the night shift like a thunderclap. "Where is the nurse who saw what your doctors missed?" The room went silent. Because that nurse had been fired 6 hours ago. If this story already has you hooked, do me a favor. Hit that subscribe button and follow along until the very end. Drop a like and leave a comment telling me what city or country you're watching from. I want to see exactly how far this story travels. Now let's get into it. PA. The morning Elena Marsh got fired started the same way every other morning at Harlow General had started for the past 3 years, with bad coffee, a locker that wouldn't close all the way, and a 12-hour shift that would almost certainly run 14. She'd learned not to fight the small things. She poured the coffee anyway, black, no sugar, standing at the nurse's station counter while the night crew handed off to days in the usual chaos of overlapping voices and shuffled charts. The ER at Harlow General never really slept. Silver Bend, Oregon wasn't a big city, population just under 80,000, but the hospital sat at the junction of 2 major highways and pulled trauma cases from 4 counties. The ER could go quiet for 2 hours and then explode with 3 ambulances at once. Elena had learned to read those rhythms the way she'd once learned to read terrain. That part of her life she didn't talk about. "You've got bed 4, bed 7, and the kid in 9 is still waiting on labs," said the outgoing charge nurse, Danny Reyes, sliding a tablet across the counter without looking up. "Bed 7's a migraine. She's already asked for morphine twice, and the doc said no, so just brace yourself." "And bed 9? 14-year-old MVA came in about 40 minutes ago. Mom says he was fine, wants to go home. Ortho cleared the obvious stuff." Danny finally looked up, and something in her expression was careful. "Dr. Calloway already assessed him." Elena registered the pause. Dr. Calloway. Dr. Stephen Calloway, ER attending, 9 years at Harlow General, the kind of doctor who walked into a room already certain of the conclusion. He wasn't incompetent. That was the frustrating thing. He was fast, and he was usually right, and he had the confidence to match, which meant that when he was wrong, he was catastrophically wrong, and nobody around him moved fast enough to catch it. She took the tablet. "I'll go see him." "Elena." Danny's voice dropped to register. "Calloway's still on. He signed off on bed 9. "I know. I'm just saying." "I heard you," Elena said, and she took her coffee and walked toward bay 9. The boy's name was Tyler Oakes. He was 14 and small for it, the kind of kid who probably got mistaken for 12, with ears that hadn't quite caught up to his face yet, and a nervous energy that made him fidget even lying on a hospital bed. His mother, Sandra Oakes, was standing against the wall with her arms crossed and her jaw set, the posture of someone who had decided they were leaving and was waiting for someone to officially confirm it. "Hi," Elena said, pulling the curtain behind her. "I'm Elena, one of the nurses. I just want to do a quick check before we wrap things up, okay?" "The doctor already," Sandra started. "I know, and I'm not going to keep you long." Elena smiled at Tyler. "How are you feeling?" "Fine," he said. The universal 14-year-old answer. "On a scale of 1 to 10, where's your pain?" "Like a 4, maybe. My shoulder's sore." "That's from the seatbelt. The doctor explained that part," Sandra said. "He said it was bruising." Elena nodded and reached for the pulse ox, clipping it to Tyler's finger while her eyes moved across him in the practiced, automatic way that 3 years in this ER and 4 years before that, in places she didn't talk about, had made second nature. She noted his color. She noted the way he was holding himself. She put one hand gently on his abdomen and said, "Tell me if this feels different anywhere," and watched his face rather than his words. He winced, just slightly. Right upper quadrant. He tried to cover it. "That hurt?" Kind of. It's probably nothing. Elena kept her face neutral. She pressed gently at his left shoulder. Care's sign. Referred pain. And Tyler's breath caught. That's tender? A little. She straightened up. Okay? You're doing great. She turned to Sandra. Can I get you some water? There's a family lounge right down the... Is something wrong? Sandra's arms uncrossed. I just want to check one more thing. Give me a few minutes. Elena was already moving. She found Dr. Calloway at the nurse's station writing notes on a different patient, his reading glasses pushed up into his hair, a half-eaten granola bar on the counter beside him. He was 53, silver-templed, the kind of handsome that had probably opened doors for him 20 years ago, and now just made him look distinguished and slightly unapproachable. Bed 9, Elena said. He didn't look up. Cleared. His abdomen is guarding. He flinched on right upper quadrant palpation, and I got referred shoulder pain on the left side. Calloway wrote something. Kids guard with abdominal muscles when they're anxious. He was in a car accident. He's nervous. That's possible. I'd like to get a fast exam. Now he looked up. The ultrasound? Yes. Elena. He set his pen down with the deliberateness of someone explaining something to a person they've explained things to before. I did a full assessment. The accident was low speed, the seatbelt sign is consistent with bruising, his vitals are stable. He's not showing hemorrhagic symptoms. His BP is 108/70, which is within normal range. It's at the low end for a 14-year-old who came in after adrenaline. Calloway leaned back in his chair. What are you suggesting? I'm not suggesting anything. I'm asking for a fast exam to rule out internal bleeding. You're asking me to add imaging to a case I've already cleared based on, he gestured vaguely, a hunch, based on clinical signs. I've been practicing emergency medicine for 15 years. I know. She didn't move. I'm asking for a 15-minute ultrasound. He looked at her for a long moment. There was something in his eyes that wasn't anger exactly. It was the particular brand of irritation that came from feeling like your authority was being questioned by someone who had no right to question it, and knowing that making a scene would look worse than simply dismissing the concern. I'll note your observation in the chart, he said, and picked up his pen. Bospad. Elena went back to bed 9. She checked Tyler's vitals again. His heart rate had ticked up slightly, 96 now, where it had been 88 when she first came in. His skin was slightly cool to the touch, a subtle clamminess. His mother was asking him something about what he wanted for dinner when Elena said, quietly but clearly, Tyler, I need you to tell me the truth. Is the pain getting worse? Tyler glanced at his mother. A little, he admitted, like maybe more than a 4 now. Sandra Oakes stood up straight. What's happening? I need to get a physician back in here, Elena said. Right now. Tyler, just stay still for me. She stepped out of the bay and didn't go back to Calloway. She went to the charge station and paged the attending hospitalist on call, Dr. Nadia Okonkwo, internal medicine, who had cross coverage on the floor above, and she explained what she was seeing in 30 seconds flat, the kind of compressed clinical briefing that didn't leave room for argument or interpretation. Okonkwo came down in 4 minutes. She examined Tyler. She ordered the fast exam. The ultrasound showed free fluid in the abdomen, blood, pooling, consistent with a lacerated spleen. Tyler Oakes was in surgery 40 minutes later. Twas. The surgery went well. The pediatric surgeon, Dr. Yolanda Marsh, no relation to Elena, a coincidence that had caused confusion twice before, repaired the laceration, and Tyler came out of the OR stable, his mother in tears in the waiting room, squeezing Elena's hand when she came to deliver the news. You saved him, Sandra kept saying. You saved my boy. Elena said, the surgical team saved him. I just asked the right question. It was the kind of thing she said because it was true, and because it was also simpler than the alternative, which was explaining how she'd known and why she'd pushed past Calloway, and what it felt like to see something that everyone else was walking right past. That explanation had a longer history than most people at Harlow General knew about, and Elena had spent 3 years carefully not giving it. She went back to her other patients. She finished her shift. She thought maybe naively that it was over. It wasn't over. Dr. Stephen Calloway's complaint was filed by noon. Elena found out at 2:15 p.m. when the unit manager, Patricia Glover, appeared at the nurses' station with the particular combination of sympathy and bureaucratic resignation that meant someone was about to have a very bad afternoon. "Conference room," Patricia said, low. "Now, if you can." The conference room on the administrative floor of Harlow General was the kind of room that had been designed to feel neutral and ended up feeling exactly like what it was. A room where difficult conversations happened. Round table, 6 chairs, a whiteboard that still had a medication protocol on it from some meeting earlier in the week. Patricia sat across from Elena, and next to her was someone Elena didn't recognize. A man in his late 50s in a well-fitted suit jacket, reading glasses on a lanyard, the carefully organized stillness of someone who managed people for a living. "This is Mr. Gerald Foss," Patricia said. "He's the hospital administrator." Elena had heard the name. She'd never been in a room with him before. "Ms. Marsh," Foss said, "Dr. Calloway has filed a formal grievance regarding an incident in the ER this morning. He stated that you bypassed his clinical authority, contacted an off-service physician without his approval, and effectively countermanded his discharge decision for a patient." "I flagged a patient I believe was at risk," Elena said. Dr. Calloway had cleared him for discharge. "Yes, and Dr. Calloway was the attending physician of record. The patient had signs of internal bleeding. His spleen was lacerated." Foss folded his hands on the table. "No one is questioning the outcome, Ms. Marsh. The patient received appropriate care. What we're addressing is the process." The process nearly sent a 14-year-old home to bleed internally. Patricia made a small sound that might have been agreement. She covered it quickly. "There are protocols," Foss said, "that exist for very specific reasons. When a physician makes a clinical decision, the escalation pathway for a nursing concern is to speak to the charge nurse, who then speaks to the attending, who then— I did speak to the attending. He dismissed my concern and told me he'd noted in the chart. And the appropriate next step was to document your own concern and allow the attending to make the final call." Elena looked at him steadily. The appropriate next step was to make sure the patient didn't die. Foss's expression didn't change, but something behind it shifted, the slight tightening around the eyes of someone who wasn't used to being answered that plainly. "Ms. Marsh," he said, "you've received 3 informal notes in your file over the past 18 months, all related to similar issues of following established chain of command. We consider this a pattern. I consider it a pattern of noticing things other people miss. That's not your determination to make." Elena said nothing. "Your nursing license requires you to operate within defined scope of practice. You're not a physician. You're not authorized to override physician decisions. Dr. Calloway is an experienced, credentialed attending who missed a splenic laceration, who made a clinical judgment that was subsequently revised by another physician," Foss said. His voice had the precision of someone choosing words for a paper trail. "In light of this incident and the existing documentation in your file, we are suspending you, effective immediately, pending a formal review." "Pending a formal review," Elena repeated. "Your badge will be collected at the end of this meeting. Your access will be deactivated. You'll receive written notice by the end of business today." Patricia wouldn't meet her eyes. Elena thought about Tyler Oakes, about the number on his BP readout, about the way he'd tried to hide his wince. She thought about what would have happened if she'd followed the escalation pathway and documented her concern and let Dr. Calloway's discharge stand. "Okay," she said. Foss blinked. He'd been prepared for argument. "Okay," Patricia said quietly. "Okay." Elena pushed her badge across the table. "I'll need the written documentation within the timeline required by my employment contract, and I'd like a copy of Dr. Calloway's complaint on file." "That's not standard. It's standard under state employment law when a suspension leads to termination," she said. "I'm not a physician, but I do know what my rights are." She stood up and she left the room, and she did not look back. The locker room was empty when she cleared it out. 12 minutes. She'd done this before, clearing a space on short notice, moving fast without making it look like it hurt. She put her stethoscope in her bag. her extra set of scrubs, a small framed photo that had lived on the top shelf, taken somewhere flat and hot and very far from Silver Bend, Oregon, of a woman in desert uniform squinting into sunlight and looking like she had the whole world figured out. She didn't take that version of herself out very often anymore. She zipped the bag. She walked to her car. She sat in the parking lot for a moment longer than she needed to, not crying. She was past the point of crying about things like this, just letting the afternoon settle around her like weather. It was 3:40 p.m. By 4 p.m., she was on the main road heading toward her apartment, a second-floor rental above a dry cleaning business that she'd lived in for 2.5 years and decorated almost not at all, which she'd always told herself was a temporary situation and which she'd long since stopped believing. She was thinking about what to do next, whether to call her union rep first or the state nursing board, whether the documentation would hold up, what her timeline looked like, when her phone buzzed. It was Danny. A text. "Call me when you can, not work stuff." She didn't call. Not yet. She needed 20 minutes of quiet first. She'd learned that about herself. The need for a specific window of stillness before she could function properly again after something went wrong. In the Army, it had been mission debrief, then silence, then next steps. The discipline of not reacting until you'd processed. She made herself a cup of tea she didn't particularly want. She sat at her kitchen table. She looked out the window at the early evening light going gold over the dry cleaner's parking lot, and she breathed and she let the day arrange itself into something she could look at clearly. She was good at her job. That was not a question in her mind, not arrogance, just fact, the same way it would be fact to say she could field strip a weapon or read a topographic map. She'd spent 4 years in places where good at her job was the difference between someone living and someone not, and she'd come home from that with her hands intact, and most of her intact, and a very quiet, very certain knowledge of what she was capable of. Harlow General hadn't known what they were getting when they hired her. She'd made sure of that. The resume had her nursing degree from University of Portland, her ER certification, her 3 years at a clinic in Bend before Silver Bend. It did not mention the 4 years before nursing school, or the unit, or the deployments, or the combat medic rating that put her skills somewhere the hospital's credentialing department had no category for. She hadn't hidden it exactly. She'd just not volunteered it. There'd never seemed to be a reason. And the longer she'd worked at Harlow General, the more she'd understood that the reason she'd not volunteered it was the same reason she'd been careful not to let it show. People treated you differently when they knew. Either they didn't believe it, and it made the dismissals worse, or they believed it and treated her like a curiosity rather than a colleague. Neither one was useful. So she was just Elena Marsh, ER nurse, 3 years at Harlow General. The one who asked too many questions. The one who followed protocol just enough to stay employed and pushed past it, just enough to make physicians uncomfortable. The one who was now suspended and probably fired. She was reaching for her phone to call Danny when the alert came through on her police scanner app. A habit from her first year in Silver Bend when she'd been trying to understand the town's patterns. She kept it on low volume, mostly background, mostly ignored. She heard multiple vehicle collision, Highway 7 North, mile marker 34. Requesting multiple units, possible critical injuries. She noted it. She didn't move. Then, 30 seconds later, be advised. Military convoy involved. Federal escort requested. Repeat, military convoy. Elena set down her tea. The convoy was 2 vehicles, a black SUV and a military transport, and they'd been T-boned by a logging truck that ran a signal at the Highway 7 interchange. The SUV had taken the worst of it, crumpling on the passenger side, and the call that went to Harlow General's ER at 4:47 p.m. described 3 occupants, 2 with minor injuries and 1 critical. Elena knew this because Danny called her at 4:52. "You're not supposed to call me," Elena said. "I know." Danny's voice had a particular tension in it. "Elena, I need you to listen." "I'm listening." "The critical patient, female, 19 years old, blunt abdominal trauma, BP dropping. They're 6 minutes out." A pause. Someone at the scene identified her. Elena, she's the daughter of General Raymond Stokes." Elena was quiet for a moment. "Okay," she said. "Calloway's on. He's going to take lead on the trauma." There was a silence that contained several things, both of them understanding what that meant, neither of them saying it directly. "Elena," Danny said, "I'm not asking you to come in. I know. I just thought you should know." She should have stayed at her kitchen table. She understood that. She had no badge, no access, no standing to walk back into that building. She was suspended, probably fired. The smart thing, the legally sound thing, the thing that protected her union grievance and her employment appeal and her nursing license was to stay exactly where she was and let Harlow General handle it. She picked up her bag and her keys. She drove. The ambulance pulled into the bay at 5:03 p.m. Elena was in the parking lot, watching through the bay doors when they brought the girl in. She was young. That was the first thing. Young in the way that 19 looks when things are going very wrong, the color already leaving the face, the body starting to do that quiet triage it does when blood goes, places it shouldn't. The paramedics were moving fast and talking fast, and the ER team was assembled and Calloway was at the head of the gurney before it stopped rolling. Elena couldn't get through the door. Her badge was gone. The security panel by the ambulance bay required active credentials. She stood at the glass panel next to the entrance and watched the team converge on the girl, whose name, according to everything Danny had told her, was Cassidy Stokes, 19 years old, according to the convoy personnel who'd called it in. Elena watched the way the team was moving. She watched the monitors on the wall she could partially see from where she stood. She watched Calloway's posture, the confident, measured certainty of a physician who'd made up his mind before he finished the assessment. She saw the BP reading on the main monitor from 40 feet away, 94/62 and dropping. She saw the way Cassidy moved, that faint, involuntary guarding, the shallow breathing, the skin color. She'd seen this before, not in an ER. In places that didn't look anything like a hospital, where the field beneath you was hard and the light was wrong, and the sounds outside were sounds you didn't think about, and you had 60 seconds to figure out what was killing someone and what you could do about it. She knew what she was looking at. She pulled out her phone. She called Danny. Danny picked up on the second ring, breathing hard, clearly in the middle of something. "Elena, I can't." "She has a liver injury," Elena said. "Left lateral lobe or the right lobe, probably with active hemorrhage. Her BP pattern isn't stabilizing with whatever fluids you're running. She needs imaging now. CT angio of the abdomen, not just a fast exam. And if her pressure drops below 85, you're already behind." "Elena, Calloway is..." "I know Calloway is there. I'm telling you what I see from the parking lot. You put me in your chart notes. You put my name on a concern flag. You do whatever you have to do to make this legal. But someone needs to push for the CT angio right now, not in 10 minutes. A pause. The sound of monitors. The sound of someone calling a number. "How do you know?" Danny's voice was low, almost a whisper. Elena watched Cassidy Stokes through the glass panel. The girl's hand moving slightly, reaching for something that wasn't there, the unconscious reach of someone in pain that they can't fully articulate yet. "Because I've seen this before," Elena said. "Get the scan." She hung up. She stood in the parking lot of the hospital that had fired her 6 hours ago and watched the trauma bay through the glass, and she waited, and she tried to remember how to breathe in a way that didn't feel like holding something back. Inside, she could see the team shift, not dramatically, not all at once, but the kind of redirect that happens when one person in a room changes direction and the others have to adjust. She saw someone move to a phone. She saw Calloway turn, his posture slightly altered, slightly uncertain. She saw the transport team wheel a gurney toward radiology. 7 minutes later, her phone lit up with a text from a number she didn't have saved. "Liver. Right lobe. Significant hemorrhage. Surgical team called. N.O. Nadia Okonkwo." Elena closed her eyes for 1 second. Then she heard the vehicles. She heard them before she saw them. That particular low rumble of heavy-duty government transport, the kind with reinforced chassis and tires that were built for roads that weren't always roads. 2 black SUVs and a military vehicle, moving through the hospital parking lot with the kind of unhurried certainty that meant the people inside them were not people who expected to wait. The first SUV stopped at the main entrance. The door opened, and the man who stepped out was tall and straight in the way that 25 years of military posture puts into a person's spine so deep it never comes out. Dress uniform, 4 stars on his collar, a face that had the settled, stone-cut quality of someone who had given orders in situations where the wrong order got people killed. General Raymond Stokes walked through the entrance of Harlow General like a man who had not yet been told whether his daughter was alive, and the staff inside had approximately 4 seconds to realize that the landscape of this evening had just changed completely. Elena stood in the parking lot. She didn't go inside. Not yet. Because from where she stood, she could see the general's face when he got to the trauma bay doors. The way his jaw moved, the way his hands went flat against his sides, and the particular control of someone who was managing something enormous. And she could see through the glass the moment he turned and said something to the physician nearest to him, and that physician shook their head, and the general said something else. She couldn't hear it, but she saw the way the room responded, and she saw the moment, just a flicker, visible from 40 feet away through a glass panel, when someone pointed out toward the parking lot. She saw Gerald Foss, the hospital administrator, appear in the trauma bay doorway. She saw him look through the glass. She saw his expression. General Raymond Stokes turned and looked through the glass door, and his eyes found her in the parking lot with the precision of someone accustomed to finding exactly what he was looking for in environments that were trying to hide it from him. Elena Marsh stood still. She met his gaze. She waited. The general didn't move toward her immediately. That was the first thing Elena noticed. He didn't rush, didn't wave her in, didn't do any of the things a panicked parent might do. He stood at the glass and he looked at her with the particular stillness of a man who had spent decades making decisions about people in the first 30 seconds of meeting them, and he was making one now. Then he turned and said something to Gerald Foss. Foss shook his head. Stokes said it again. Whatever it wasn't a request. Elena watched Foss's posture change, not dramatically, but the way a building shifts when the foundation moves. That small, structural rearrangement of a man who has just understood that the hierarchy in this room is no longer the one he's used to operating in. He turned toward the main entrance. He pushed through the door. He walked across the parking lot toward Elena with his hands clasped behind his back and his expression set to something that was trying to be neutral and landing closer to uncomfortable. "Miss Marsh," he said. "Mr. Foss." He stopped a few feet from her. Behind him, through the glass, she could see the general still watching. "The general wants to speak with you." "I was told I don't have access to the building." Foss's jaw tightened slightly. "We can make a temporary accommodation." "An accommodation," Elena said. "Ms. Marsh, 6 hours ago you suspended me and collected my badge. Now you're making accommodations because a 4-star general is standing in your trauma bay." She wasn't angry about it. She said it the way she'd say anything factual because it was useful to name what was actually happening. "I'll come inside, but I want it documented that I was asked to return, that the request came through you, and that I have not been formally terminated as of this moment." Foss looked at her. "I can note that. Note it in writing before I walk through that door." He pulled out his phone. He typed something. He turned the screen toward her. A brief internal message to Patricia Glover, time-stamped, stating that Elena Marsh had been requested to return to Harlow General at the direction of hospital administration following a critical patient situation, and that her employment status remained under review pending formal proceedings. It wasn't much, but it was something. "Thank you," Elena said, and walked past him. Then the automatic doors opened and the ER sounds hit her, the monitors, the voices, the particular compressed energy of a department running at high load. And Elena felt her body do what it always did when she walked into a working trauma space, which was that it stopped being her ordinary body and became something quieter and more precise, like a machine that has found the frequency it was built for. General Stokes was waiting just inside the bay corridor. Up close he was taller than she'd estimated, 6'2" at least, and the uniform wasn't decoration. It fit a frame that had stayed useful. His face was older than his posture suggested, the lines deep, the eyes the specific gray of someone who had spent a lot of years in harsh light. Right now, those eyes were doing the same thing they'd done from 40 feet away, which was looking at her with an assessment that was professional first and personal second. "Miss Marsh," he said, "General, you called in a liver injury from the parking lot. I flagged a concern to a colleague inside. Through glass." His voice was flat, not accusing, just noting, before the imaging confirmed it. "Yes." He didn't say anything for a moment. Two of his personnel were positioned at either side of the corridor, not interfering, just present. One of them was a woman in her 30s with the watchful stillness of someone in a protective detail. The other was a young man barely out of his 20s who kept his eyes moving. "My daughter," Stokes said. "What's her status?" "I'm not her treating physician. I don't have current information." Elena paused. "What I know is that imaging confirmed a right lobe liver laceration with active hemorrhage, and that the surgical team was called as of approximately 17 minutes ago. If they moved quickly, she's in the OR by now." "They moved quickly?" "I believe so." Something moved in his face, not softness exactly, but the controlled release of a man who has been holding a very specific kind of tension and has just been given one piece of information that makes it slightly easier to keep holding it. "How did you know?" he said. "BP pattern, skin presentation, the mechanism of injury from the paramedic report, and the way she was moving her hands." Elena stopped. "Some of it's training, some of it's pattern recognition, some of it you can't fully explain in a way that sounds scientific." Stokes looked at her for another moment. "What kind of training?" The question hung there. Elena was aware of Foss somewhere behind her, of the staff at the nurses' station, who were trying not to watch and failing, of the entire architectural pressure of the situation. A general asking her a direct question in the hospital that had fired her 8 hours ago. "The kind that's relevant to tonight," she said. It was the most she'd said about it in 3 years. It was also, she understood, not enough. Not for a man like this who would find the rest of it without her help. She could see in his expression that he already knew she'd given him a partial answer and had chosen to accept it for now, which meant he was filing it for later. "All right," he said. "Come with me." He didn't take her to Cassidy's room. There was no room yet, only the OR somewhere above them, but to a small family consultation space off the main corridor, the kind of room that had 3 chairs and a box of tissues and a table with a water pitcher that nobody ever touched. One of his personnel positioned outside the door. The woman from the protective detail stayed inside near the window, quiet. Stokes sat down. He gestured at the chair across from him. Elena sat. "Tell me what you saw," he said. "From the beginning, the ambulance, what you could observe from outside. All of it." So she told him. She was precise about it. She'd learned a long time ago that precision was the best respect you could give someone who needed information in a crisis. Not hedging, not softening, just the sequence of observations and their logical implications. She told him about the BP reading she'd seen from the parking lot, about the guarding, about Cassidy's skin and breathing pattern, about what the numbers told her when she read them against the mechanism of injury. He listened without interrupting. At one point he leaned forward slightly, elbows on his knees, and she could see him processing it the way someone does when they're trained to process field reports. Not just hearing it, but building the picture, testing it against what he already knew, checking for gaps. When she finished, he was quiet for a moment. "Dr. Calloway," he said. He's the attending on the case, yes." He missed it. He hadn't run full imaging yet when I made the call. I don't know what his full assessment was. Stokes's eyes said he knew exactly what her careful phrasing meant. "What I'm told," he said, "is that the nursing staff inside flagged an elevation of concern after receiving a call from someone outside the building. That flag is what prompted the imaging order." He paused. "That the attending physician had not yet ordered it independently." Elena said nothing. "That's not a political statement," Stokes said. "That's what I was told." "I understand." "Why were you outside the building?" She'd expected the question. "I was suspended this afternoon." "Suspended," he repeated. "Today?" "Yes." "For what?" for flagging a clinical concern that the attending physician disagreed with. She kept her voice even. The patient survived. The physician filed a complaint. The administrator suspended me. Stokes sat back in his chair. He had the quality that very senior military personnel sometimes had of being able to stay completely still in a way that didn't read as passive. It read as a man thinking, and it would be very unwise to interrupt. "And yet," he said, "here you are." "Here I am," Elena said. Masham. It was another 40 minutes before anyone came to tell them about Cassidy. Elena stayed in the room because no one told her to leave, and because the general had made it clear without saying it directly that he wanted her there. She drank a cup of water. She watched Stokes sit with the particular quality of waiting that she recognized. The kind you learn when waiting is operationally necessary and falling apart is not an option. At one point he said, without looking at her, "She was supposed to be at base, change of plans, last minute." He stopped. That's the part that's hard. The last minute. Elena didn't say anything. She knew better than to fill that kind of silence. "Her mother passed 4 years ago," he said. Then he stopped again like he'd said more than he meant to, and his face closed back into itself. The surgeon who came to the door was Dr. Felix Hargrove, trauma surgery, a compact man in his late 40s with scrub cap lines in his hair and the slightly dazed quality of someone who'd just come out of a long focus and hadn't fully re-entered the ordinary world. He took in Elena's presence with a brief flicker of uncertainty, then looked at Stokes and delivered the report. The laceration had been complex, so a grade 3 on the right lobe, with a secondary injury to a hepatic vessel that had been the source of most of the hemorrhage. They'd repaired it. She was stable. She was in the ICU. She would need to stay down for several days, but there was no indication of neurological compromise, and her prognosis was favorable. Stokes absorbed this information with a stillness that Elena recognized as relief so large it had to be held very carefully or it would break something. Hargrove glanced at Elena again. "Can I ask, are you part of the patient's care team?" "No," Elena said. "She's the one who caught it," Stokes said, without turning around. Hargrove looked at her. Then something shifted in his expression, not quite recognition, but the recalibration of a man who has been given a piece of information that changes the shape of the story he was already telling himself. "The flag that came through from outside the building," he said slowly. "That was you?" A colleague relayed a concern I'd identified. You identified a right lobe liver lac from outside the building," Stokes said. His voice had changed slightly. Not louder, just different. Hargrove looked between them. He made the face of someone who is choosing not to say several things and instead says, "I'll need to update the chart," and excused himself with the air of a man who has just understood that there's a much larger situation here than a trauma case. The larger situation arrived in pieces over the next 90 minutes, the way things tend to when institutions realize the story they've been telling about something is wrong, and they have to figure out how to stop telling it without making it obvious they ever told it. Patricia Glover appeared in the corridor outside the consultation room, spoke briefly to Foss, disappeared. Foss appeared in the doorway, started to say something to the general about scheduling a conversation with administration, and Stokes turned and looked at him with an expression so precisely calibrated to indicate that now was not the time that Foss closed his mouth and left. Nadia Okonkwo came by, still in her white coat, and knocked on the door frame. She was a tall woman, Nigerian-British by Elena's guess, mid-40s, with the organized efficiency of someone who had learned to navigate hospital politics without getting swallowed by them. She looked at Elena with something that was part apology and part complicated respect. "The text was you," Elena said. "I got a call from Danny. She told me what you'd said." Okonkwo's voice was measured. "I've worked in this hospital for 6 years. I've never gotten a call from a parking lot before. I'm sorry for the unusual channel." "Don't apologize for that." She glanced briefly at Stokes, who was listening without pretending not to. "I ordered the scan because the clinical reasoning you described to Danny was sound. I want to be clear about that. I made the call based on the reasoning, not just on your word." "I know, but I also want to be clear," Okonkwo said, and her voice dropped slightly, not conspiratorial but careful. That what you described to Danny this afternoon, the clinical picture you identified from those vital signs, and that patient presentation, that's not standard nursing assessment. That's something else. Elena said nothing. Okonkwo looked at her for a moment, and her expression was the expression of someone who has filled in the blank and is deciding whether to say it out loud. She decided not to. "I'm glad the patient is stable," she said simply, and left. The something else that Okonkwo had not named was something Gerald Foss was in the process of discovering via a conversation he was having in his office with two people from General Stokes's staff, a JAG officer named Major Rhea Tatum, and a personnel specialist Elena caught a brief glimpse of through the window in the corridor, a woman in her 30s with a laptop and the expression of someone who had pulled records before and was pulling them now. Elena knew this because Danny texted her. Foss's office has been occupied for 45 minutes. JAG officer in there. Admin assistant says she heard the words employment documentation and federal inquiry, and then the door closed. Elena read the text. She put her phone in her pocket. She was in the ICU waiting area by then, having been given a visitor badge by a floor nurse who hadn't asked many questions and had looked at the general's personnel flanking the hallway and apparently decided that asking questions was above her current pay grade. Stokes had gone in to see Cassidy for 10 minutes. He'd come back out looking like a man who had returned from somewhere very far away. He sat down in the chair across from Elena. "She's awake," he said, asking for water and complaining about the IV placement. "That's a good sign." "Yeah." He rubbed his face with one hand, the first unguarded thing he'd done since she'd met him. For a moment he just looked tired, the way a person looks when the adrenaline is leaving and what's underneath it is older and heavier than the crisis was. "She takes after her mother, argues with everything. Doctors, nurses, doesn't matter." He paused. "I used to think that was going to cause problems for her. Now I think it's the thing that'll keep her alive." Elena looked at the floor. "It's usually the ones who ask questions." He let the quiet sit for a moment, then, "Tell me about your service." She'd expected it eventually. "What do you want to know?" "Whatever you're willing to say." She considered. 3 years of not saying it, and now here was the question in a quiet hospital corridor from a man whose daughter was alive partly because of what that service had given her. The answer felt different than it would have this morning. "Combat medic," she said, 68W. 4 years, 2 deployments, Kunar province, and 1 tour I can't name the location for. She paused. "I left as a staff sergeant, lateral career change to nursing after discharge." Stokes absorbed this. "Kunar." "Yes, sir." "That was what years?" She told him. He nodded slowly, the nod of someone connecting dates to events they know well. Kunar in those years was not a light assignment. No. "Casualties?" "My unit had 11 KIA over 18 months. I treated 60 plus in the field." She said it the way she'd always said anything about that time. Not with distance exactly, but with the specific emotional compression that let you talk about things that mattered enormously without the conversation collapsing under the weight of them. "I learned to read injuries fast. You don't have equipment, you don't have the right light, you don't have a radiology suite. You read what's in front of you and you make a call." And the nursing, that was after. University of Portland, 3-year program, then clinic work, then here. Why Silver Bend? It was a fair question. Silver Bend was not a place people ended up because it was the obvious next step. "Quiet," she said. "I wanted something that was a different kind of hard." Stokes was quiet for a moment. "Did you find it?" Elena thought about the locker room that afternoon, the conference room, the badge on the table, Tyler Oakes's face when she told him he was going to be okay. "Some days," she said. He leaned forward slightly. "I'm going to have some questions asked about this hospital, Ms. Marsh, about what happened today with my daughter's case and what that attending physician did and didn't do. And I want to be clear that those questions were going to be asked regardless of who you are or what your service record is." He paused. "But I also want to be clear that what you told me earlier, the pattern of you flagging concerns, the suspensions, the complaints, I've read that particular story in other places, in units under my command, and it rarely reflects well on the institution. Elena looked at him steadily. I'm not asking for anything, General. I know you're not. He met her eyes. That's worth noting. Agag. At 9:15 p.m., Danny appeared in the ICU waiting area. She was still in her scrubs, technically 2 hours past the end of her shift, with the specific wired exhaustion of someone who had been running on adrenaline and was only now starting to feel the edges of it. She sat down next to Elena and said quietly, Calloway knows. Knows what specifically? That it was you, that the call came from outside, that the liver finding came from a tip that was, technically, a suspended employee calling in a clinical observation through a back channel. Danny's voice was low and careful. He's been in with Foss for 20 minutes. I don't know what they're saying. What do you think they're saying? Danny exhaled. I think Foss is trying to figure out whether this saves the hospital or makes things worse for them. Because on one hand, the general's daughter is alive. On the other hand, she's alive because a nurse they suspended 6 hours ago was smarter than the attending physician they kept on shift. Elena nodded slowly. And there's a JAG officer in Foss's records, Danny added, which, I've been at this hospital 9 years, and I've never seen a JAG officer in records. What are they pulling? From what I can tell, everything. My understanding is it started as Cassidy Stokes' file, but Danny paused. Word from the admin assistant is it's expanded. Employment records, incident reports, the complaint files from the past 18 months. Elena felt something shift. Not dramatically, just the quiet internal movement of something that has been positioned one way for a long time, beginning to move to another position. All of it. The 3 informal notes in her file. The complaints she'd made that disappeared. The concerns she'd documented that went nowhere. All of it was now in a folder in Gerald Foss's office, with a military legal officer reading it. You should go home, Elena said to Danny. You've been here long enough. So have you. I have a reason to stay. You've got a reason to go eat something and sleep. Danny looked at her with the particular expression of someone who wants to argue and is too tired to. Are you okay? Yeah. I mean, actually, Elena thought about it for a moment, the kind of honesty the question deserved. I'm tired, she said, and I'm not sure what happens next, but I'm okay. Danny left. Elena stayed. She was still there at 10:30 when Major Raya Tatum, the JAG officer, appeared in the doorway of the waiting room. She was a compact woman, somewhere in her mid-30s, with the economy of movement of someone who was perpetually conscious of her time. She looked at Elena with the slightly assessing expression of someone who had been reading about her for the past hour. Miss Marsh, she said, I have some questions, if you have time. I have time, Elena said. Tatum sat. She placed a tablet on the table between them. She said, I've been reviewing documentation related to this hospital's handling of a series of clinical flagging incidents over the past 18 months. In several of them, I'm seeing your name connected to a documented concern that was subsequently dismissed or minimized, followed in some cases by adverse patient outcomes that weren't internally investigated. She paused. Are you aware of those cases? Elena felt the prickling at the back of her neck that was not quite fear but was adjacent to it, the specific sensation of a situation expanding faster than you can fully track. Some of them. Were you the one who filed the concerns? Some of them, yes. Tatum looked at her. Miss Marsh, I want to be straightforward with you. What I'm looking at in this documentation is not just tonight's incident. What I'm looking at may represent a systemic pattern of suppressed clinical concerns in this emergency department. She paused, which means this may be considerably larger than a disagreement between a nurse and an attending physician. Elena's hands were very still in her lap. From down the corridor came the sound of voices. 2 of them, one of which she recognized as Gerald Foss, elevated slightly, the practiced control of a man accustomed to managing difficult conversations, and the other voice that was harder to hear clearly but had the specific quality of someone who was not being managed. She couldn't make out the words, but she saw, through the glass panel at the end of the corridor, Foss turn, and behind him, Dr. Calloway, and behind Calloway, two more of General Stokes's personnel, and the expression on Foss's face was the expression of a man who has just understood that the walls he thought were holding are not holding, and that what is on the other side of them is much bigger than anything he had prepared for. Tatum was watching Elena's face. "Are you all right?" Elena looked away from the corridor. She looked at the JAG officer across the table, at the tablet between them, at the document folders visible on the screen, her name, the dates, the string of suppressed warnings that had lived in a file cabinet for 18 months and were now, apparently, evidence. "Yes," she said. And then, from somewhere down the corridor, she heard Foss's voice crack. Not loudly, just enough, the specific vocal fracture of a man saying something he did not want to say. And she heard him say the name, her name. And then she heard General Stokes's voice, quiet and absolutely level, ask a question that she couldn't fully make out but whose meaning was clear from the shape of it. The last thing Elena heard before Tatum turned to close the door of the consultation room for privacy was Gerald Foss saying, with the specific flatness of a man who has run out of alternatives, that Elena Marsh had been suspended for reasons that the hospital was prepared to reconsider. Tatum looked at Elena across the table and said, "Before we continue, I need to know everything you reported, everything you documented, and everything that was done with it." She opened a new document on her tablet. From the beginning. Elena looked at the blank document. She thought about 18 months of careful notes filed into a system that buried them, of 3 informal warnings, of a boy named Tyler Oakes who had nearly bled to death because a physician's pride was worth more than his assessment, and of a girl upstairs in the ICU who was alive right now because Elena had stood in a parking lot and trusted what her hands and eyes and every year of her life had taught her to recognize. She thought about all of it. Then she said, "How much time do you have?" And from somewhere beyond the closed door came the sound of Foss's voice and Calloway's voice, and the voices of 2 men standing at the edge of something they had not seen coming, something that had been building quietly for a very long time, in the file notes of a nurse who never stopped paying attention, and that was only now, finally, starting to become visible. Tatum's fingers moved to the keyboard and she said, "Take your time," which was the kind of thing people said when they meant the opposite, when what they actually meant was, "I need this quickly and completely, and I need you to be precise." And Elena understood that, so she didn't take her time. She started at the beginning. 14 months ago. A 61-year-old man named Harold Fitch, brought in by ambulance after a reported fall at home. Calloway had assessed him as a simple hip contusion, ordered an X-ray that showed no fracture, and prepared a discharge. Elena had noticed the man's confusion. Not the disorientation of pain or medication, but the specific intermittent quality of neurological compromise, the way his attention slipped sideways at irregular intervals, the way his left hand moved without him seeming aware of it. She'd flagged it to Calloway. Calloway had said, in front of 2 other nurses, that she was reading into things and that elderly patients often presented with confusion after falls. She documented her concern in the nursing notes. Harold Fitch had gone home. He'd been readmitted 40 hours later via ambulance with a subdural hematoma that had been actively bleeding for at least 24 of those 40 hours. He'd survived, but spent 6 weeks in neuro rehab. Tatum typed without looking up. "That case? Was there an internal review?" "There was a quality review flag submitted. I never received any response or follow-up." Elena paused. "I followed up twice in writing. Both times I was told the review was ongoing." "And the review outcome?" "I was never informed of one." Tatum's jaw moved slightly. She kept typing. Elena told her about the next case. A 38-year-old woman, chest pain, atypical presentation. Calloway had been off that night. This one was a different attending, Dr. Marcus Webb, who was no longer at Harlow General and whose departure 6 months ago had been described internally as a mutual agreement. The woman had been assessed as anxiety, given a prescription for lorazepam, discharged. She'd coded in the parking lot 15 minutes later. Her cardiac event was survivable. She'd been resuscitated and spent 3 days in the cardiac ICU, but only because a paramedic happened to be walking to her car from the adjacent clinic. Elena had filed a formal concern about the discharge decision within 48 hours. She'd also, because she'd been at this long enough to know how quickly paper disappeared, photographed her own documentation with her phone before submitting it. "You kept copies," Tatum said. "Yes." "Where?" "Personal cloud storage, encrypted." Elena paused. "I can share access tonight if that helps." Tatum looked up from her screen for the first time in several minutes. She had the expression of someone recalibrating the size of what they're dealing with. "Yes," she said quietly. "That would help." Cut. They were 40 minutes into it when the door opened. It wasn't a knock. It was the door simply opening, which was itself a statement, and the person who opened it was General Stokes, which explained why nobody had stopped him. He looked at the two of them at the table, looked at the tablet, looked at Elena's face, and read the room with the competence of someone who had been reading rooms professionally for 25 years. "How long do you need, but?" he asked Tatum. "At least another hour, possibly more." He nodded. "I'll be in the ICU." He looked at Elena. "My daughter wants to know who called the shot on her scan." Elena blinked. "She's asking?" "She's 19. She came around from the anesthesia wanting a full account of everything that happened. She's—" Something moved in his face that was not quite a smile and not quite grief, just something very human that sat between the two. "She's a handful." "Tell her a colleague made the call," Elena said. "She'll find out eventually." "She can find out eventually, then." He held her gaze for a moment, then left, pulling the door closed behind him. Tatum watched the closed door briefly, then turned back to her screen. "He came in here to check on you," Tatum said. "Not an accusation, just an observation." Elena said, "He came to check on the timeline." Tatum made a small sound that might have been agreement and might have been something else. "Okay, the Webb case. You said you documented it within 48 hours. Walk me through exactly what you submitted and to whom." Elena walked her through it. At 11:45, while Elena was in the middle of describing the fifth case, a pattern of delayed sepsis recognition in the ER that she'd raised 3 times in writing over a 4-month period, the room's quality changed. It was subtle, a shift in the ambient sound from the corridor outside, a different texture to the voices. Tatum noticed it too. She glanced at the door. Elena said, "Someone's outside." Tatum stood. She opened the door. Gerald Foss was in the corridor with Dr. Calloway, and a third person Elena hadn't seen before. A woman in a dark blazer, late 50s, with reading glasses on a chain and a leather portfolio that had the specific worn quality of something carried daily and professionally. Hospital legal counsel, Elena guessed. She had that exact posture. Foss's eyes went to Elena and stayed there with a flatness that was working hard to conceal something underneath it. "Major Tatum," he said, "I'd like to request that this conversation be paused until we can have representation present." "This is an informal interview, Mr. Foss. Miss Marsh is not being deposed." "Regardless, given the scope of what you appear to be, Mr. Foss," Tatum's voice didn't rise, it didn't need to. "You can retain whatever counsel you'd like for conversations in which you are a participant. This conversation doesn't include you." The woman in the blazer touched Foss's arm. Something passed between them. Calloway, behind Foss, was looking at Elena. His face had a quality she hadn't seen there before, not the confident dismissal of the man who'd told her she was stepping outside her role, but something more complicated. Something that looked, at a very uncharitable angle, like a man beginning to understand the geometry of his own position. She didn't feel satisfaction about it. She'd thought she might, and she didn't. Mostly, she just felt tired. Tatum closed the door. She sat back down and picked up her tablet and said, "Sepsis recognition protocol. You were saying you raised it 3 times. Elena continued. She was done by 1 a.m. She'd walked Tatum through 8 separate incidents over 14 months. 8 documented concerns filed through proper channels, noted by nursing staff, and either ignored or suppressed by hospital administration. In 3 of those cases, there had been adverse patient outcomes. In 2 of those cases, the outcomes had required extended hospitalization for conditions that might have been caught earlier. Tatum had not reacted to any of it with the visible alarm that Elena might have expected. She'd listened, typed, ask precise follow-up questions, and maintain the specific professional composure of someone who was not surprised because they'd already seen enough in the documentation to know where this was going. When Elena finished, Tatum sat back and looked at her tablet screen and was quiet for a moment. "I want to be careful about what I tell you at this stage," Tatum said finally, "because this is an ongoing inquiry and there are channels it has to go through. But I want you to know that what you've given me tonight, combined with the documentation I pulled from this hospital's internal record system this evening, represents a coherent and substantive evidentiary picture." She paused. "I've been doing this for 11 years. This is not a small thing." Elena nodded. "You should get a lawyer," Tatum said. "Not because you're in trouble, because the process that's coming is going to move fast and you should have representation advising you when it does." "Okay. Do you have someone?" "I'll find someone." Tatum looked at her for a moment with the expression of someone who has developed, over the course of 2 hours, a specific kind of respect that is also slightly weighted with something like concern. "Do you have somewhere to go tonight? You've been here since—" "I'll go home," Elena said. "I'm okay." Tatum closed her tablet. "One more thing, and this is me speaking as a person, not as a JAG officer, so take it for what it's worth." She paused. "You saved that girl's life from a parking lot after the institution threw you out. You didn't have to come back here. You didn't have to make that call." She paused. "Most people wouldn't have." Elena thought about that. "Most people haven't spent 4 years in a place where walking away wasn't an option." Tatum looked at her for another moment. Then she stood, and Elena stood, and they shook hands in the way of two people who understand they'll be seeing each other again under more formal circumstances. Elena walked out of the consultation room at 1:08 a.m. and nearly ran directly into Dr. Yolanda Hargrove, Dr. Felix Hargrove's wife, as it happened, and the head of the ICU nursing staff, which was a coincidence that Silver Bend's small hospital geography produced with some regularity. She was a broad-shouldered woman with natural hair pulled back and the alert exhaustion of someone who'd been working nights for long enough that tired was just her baseline. "Ms. Marsh," she said, "I was looking for you." "Is something wrong with Cassidy Stokes?" "She's stable. She's—" Hargrove hesitated, and something complicated moved across her face. "She spiked a fever about 20 minutes ago, 38.9. We're treating it as a precaution, running cultures. It's most likely post-operative, nothing unusual for this type of surgery." But her heart rate went up with it, 118, and her pressure dipped slightly before we adjusted the fluids. Hargrove's voice was carefully neutral. "Dr. Patel is on call for surgical follow-up. He's been notified. He thinks it's routine." Elena heard the inflection on thinks. "What do you think?" "I think her temperature came up faster than I'd expect for standard post-op inflammation, and her heart rate is elevated in a pattern that I want a second read on it. Someone who isn't invested in it being routine." There it was. Elena felt the shift in her chest, that specific recalibration, the operational part of her brain sliding forward and the tired part stepping back. "I'm a suspended employee. I can't be her treating—" "I know what you are." Hargrove's voice was quiet and direct. "I'm asking you to come look at her chart and tell me what you see. If you think I'm overreacting, say so, and I'll stand down. If you don't—" She stopped. "Doctor, Patel told me I was being anxious." The phrasing hung there. Being anxious. The same vocabulary, the same register, the same fundamental dismissal in different words. Elena went with her. Well, the ICU was quieter than the ER. A different kind of busy, slower, and more watchful. The particular tension of a space where the crises were slower building and the margins were thinner. Cassidy Stokes was in room 4, which had a glass front wall and 2 nurses doing charting just outside it. Elena stood at the glass first and looked. Cassidy was 19, and she looked it, even in a hospital bed, even post-surgery, with the pallor of significant blood loss and a tube in her arm, and a monitor running beside her. She had the specific vitality of a young person that didn't fully go away even in bad circumstances. Her hair was dark and cut short on one side, and she was awake, watching the ceiling with the slightly glassy focus of someone on pain management who wasn't quite asleep and wasn't quite all the way present. Elena watched her breathe. She counted. She watched the monitor through the glass, the heart rate at 121 now, the temp reading on the sidebar. Then she looked at the drain output recorded on the clipboard at the door. She said, "What was her drain output at the last check?" Hargrove checked her tablet. 62 milliliters in the past hour. What's her baseline been since OR? First hour post-op was 31. Second was 44. This hour is 62. Elena looked at the numbers. The trend was a slope. Not a cliff. Not yet, but a slope. The steady increase that was either normal surgical drainage tapering off in the wrong direction or something that was not tapering at all. When is her next labs? Scheduled for 4 a.m. Move it up, right now. Elena kept her voice level. CBC CMP coagulation panel and her lactate. Hargrove looked at her. If I pull labs at 1 a.m., when Patel has already said he's not concerned, then either the labs are normal and you have documentation that you acted appropriately on a clinical concern, or they're not normal and you have a patient who needed intervention 3 hours before she was going to get it. Elena met Hargrove's eyes. You came and found me at 1 a.m. because something felt wrong. That means something feels wrong. Pull the labs. Hargrove looked at her for another moment. Then she picked up her radio. The labs came back at 1:47 a.m. Elena was in the corridor outside Cassidy's room when the tablet in Hargrove's hand lit up with the results, and she watched Hargrove's face run through the sequence of reading numbers and understanding what they meant, the specific quality of a clinician who sees something she was hoping not to see. Hargrove turned the tablet toward Elena. The hemoglobin had dropped. Not catastrophically, not the kind of number that sets off every alarm in the building, but meaningfully, in a pattern that, together with the lactate elevation and the drain output trend, built a picture that was unmistakable. There was ongoing bleeding, small, but not nothing. The liver repair was weeping, not the massive hemorrhage of earlier in the evening, but blood loss in a patient who had already lost a significant volume was a different calculation than blood loss in a healthy baseline. Call Hargrove, Elena said, and then caught herself. She meant Felix Hargrove, the surgeon. She was momentarily disoriented by the shared name, and she registered the absurdity of it at the wrong moment and said, "Call the surgical team." Hargrove was already dialing. What happened in the next 22 minutes was not dramatic in the way movies make things dramatic. It was the specific drama of medicine, which was mostly people moving with intention and controlled urgency, voices slightly elevated but not panicked, hands doing things quickly and correctly. The surgical resident arrived first, reviewed the labs, paged the attending. Felix Hargrove arrived 7 minutes later in street clothes with a stethoscope around his neck, and the specific expression of a surgeon who had been woken up and was not yet certain whether he was going to be relieved or alarmed. He reviewed everything. He examined Cassidy, who was awake enough to tell him her pain level was a 6 and asked why everyone kept looking at the same screen. He ordered an emergency ultrasound of the surgical site. The ultrasound showed a small but active bleed at the repair margin. Not immediately life-threatening, but without intervention, it was not going to stop on its own. Cassidy Stokes went back to the OR at 2:19 a.m. Elena was in the corridor when they wheeled her out. Cassidy's eyes were open, and she looked at Elena, who was just a person standing against the wall in civilian clothes, no badge, no scrubs. And she said, "Are you the one who keeps catching things?" Elena said, "Go to sleep." Cassidy almost smiled. Then the gurney rounded the corner, and she was gone. Felix Hargrove was standing next to Elena. He said without preamble, "How did you know?" Drain trend, lactate, HR pattern. Patel assessed her 2 hours ago and didn't flag it. "I know." He looked at her. He was a straightforward man. She could see that in him, the kind of surgeon who was better at operating than politicking, who probably found the administrative side of medicine tedious and slightly distasteful. "You're the nurse who was suspended today." "Yes." "For flagging something that turned out to be right." "Yes." He was quiet for a moment. "This is the second time tonight." Elena looked at the floor. "Yes." "Okay," he said, and that was all he said, but the word carried something in it. Not an apology, not exactly, but the specific weight of a person who has just updated their understanding of a situation and knows they're going to have to carry that update with them. He went to scrub in. Elena stood in the corridor. At 2:31 a.m., General Stokes came around the corner from the direction of the family waiting room. He'd been told one of the ICU nurses had gone to get him when the gurney moved, and he walked toward Elena with the controlled forward momentum of a man who is not going to let what he's feeling slow him down, but who is also not going to pretend he isn't feeling it. He stopped in front of her. She said, before he could ask, "The surgical team caught a secondary bleed at the repair site. It's manageable. Dr. Hargrove is experienced and he saw it early enough." She paused. "She's going to be okay." He looked at her for a moment. The corridor was empty except for the two of them, and somewhere behind them, the distant sound of the ICU running its normal nighttime operations. "You caught it again," he said. Elena said, "The charge nurse came and got me. I just read the numbers." "That's the second time you've said something like that." His voice was quiet, not accusing, just precise. The kind of thing people say when they want to be accurate and also don't want to make it about themselves. She didn't answer that. "What you did tonight," he said, "both times. My daughter is alive right now because of decisions you made. And you made them after this institution threw you out." He paused. "I want you to understand that I have a very specific memory for what people do under pressure, and I don't forget." Elena looked up at him. In the fluorescent light of the hospital corridor at 2:30 in the morning, she was just a woman who hadn't slept, who had spent the last 12 hours being suspended and called back and interviewed and standing in parking lots reading vital signs through glass. She was tired in a way that was older than tonight. "I know you don't," she said. He nodded once. He went back to the waiting room. Elena leaned against the corridor wall and tipped her head back and looked at the ceiling, and she let herself, for just a moment, feel the full weight of everything that had happened since 3:40 that afternoon. Tyler Oakes, whose spleen had been intact before the accident, and who was in a recovery room somewhere on the 3rd floor because a doctor hadn't caught what she'd caught. Cassidy Stokes, 19 years old, who had now survived 2 bleeds in one night, and would wake up tomorrow not knowing how close it had been, twice. 14 months of documented concerns sitting in Tatum's tablet. Calloway and Foss in a room with a lawyer trying to figure out how to manage a story that had already escaped them. Elena closed her eyes. She let herself have 30 seconds of nothing, then she opened them. Her phone buzzed. She looked at it. Unknown number. Text message. 2 words and a number. Call me. Below it, a name. R. Tatum. And below that, in a second message that arrived 3 seconds later, we found the web file. The internal review wasn't ongoing. It was closed, dated 14 months ago. Outcome listed as no concern identified. Your written concern submission is not in the file. Elena read the messages twice. Your written concern submission is not in the file. She knew what that meant. She had always known, in a way she'd kept carefully controlled and deliberately suppressed, what that probably meant. But knowing it as a suspicion and knowing it as documented fact sitting in a JAG officer's hands at 2:30 a.m. were 2 different things. Her concern had not been misplaced. It had been removed. She was still looking at her phone when the OR door at the end of the corridor opened and Felix Hargrove walked out, still in his surgical gown, mask pulled down. He crossed toward her with his face set in a way that she couldn't read yet from this distance, and she felt the specific tightening in her chest of someone who doesn't yet know what the next 5 seconds are going to contain. He stopped in front of her. He looked at her for just a moment. Then he said, "She's bleeding faster than we anticipated. We need another set of hands in there who knows what they're looking at." He paused, and his eyes were steady and direct, the eyes of a man who had just weighed something carefully and made a decision. "I know you're suspended. I know what that means for both of us. But I've got a 19-year-old on my table, and I want your eyes in that room." Elena looked at him. "You can't ask me that," she said. "I know," he said. "I'm asking anyway." The scrub tech handed Elena a gown without making eye contact, which was either discretion or the particular tunnel vision of an OR team in the middle of something that needed all their attention. She took it. She pulled it on. She tied it herself because her hands knew how without being asked. Felix Hargrove was already back at the table. The anesthesiologist, a lean man named Dr. Paul Setti, who had the practiced calm of someone who had worked nights for 15 years, glanced at Elena over his monitors and said nothing. The scrub nurse, her name was Vera, Elena read it on her badge, gave Elena a look that was measuring and quick and then went back to her instrument count. Nobody asked for her credentials. Nobody said her name. Cassidy Stokes was on the table under draping, her vitals running on 4 monitors simultaneously, and the repair site that Hargrove had closed 2 hours ago had opened at a branch point in the hepatic artery that was the kind of thing you couldn't always anticipate. A small vascular anomaly, a variation in anatomy that the imaging had shown, but that became a different problem once the tissue was inflamed and stressed and working to heal itself. The bleed was slow by catastrophic standards and fast by every other standard, and Hargrove had his hands in and was working, but the field was difficult and the angle was worse. "Talk to me," he said, not to anyone specific, the way surgeons sometimes spoke in the OR. Not asking for conversation, but for the running information that helped them stay calibrated. "Pressure's holding at 89/60, Setti said. "But trending. I've got 2 units going." "Drain output?" Vera read the number. Hargrove's hands moved. He was precise, and he was fast, and he was working from an angle that didn't give him the full visual field he needed, and Elena could see it. The slight lean, the adjustment, the way he was having to triangulate. She said, "The branch point is about 2 centimeters inferior to your suture line. I saw it on the ultrasound." Hargrove paused for exactly 1 second. "Show me." She stepped closer. She didn't touch. She talked him through it, the way she'd once talked medics through procedures in the field when her hands were occupied with something else, and someone else's hands had to do the work. She described the geometry, the angle, what she'd seen on the screen, and what the anatomy suggested. Hargrove listened without asking her to repeat anything, and she watched him recalibrate his approach in real time, the small adjustments of a skilled surgeon incorporating new spatial information. It took 11 minutes. The bleed stopped. Nobody celebrated. That wasn't how it worked. The anesthesiologist read numbers in a steady voice. The scrub nurse counted instruments Hargrove closed with the specific focused silence of someone making sure every decision was correct and documented in his own mind. Elena stepped back. She stripped her gown at the door when they were done and put it in the bin and washed her hands at the scrub sink and stood for a moment with the water running over her wrists, cold, which was what she needed. Her hands were steady. They had been steady the entire time. She thought about that for a second. Not with pride, because it wasn't about pride, but with something more like acknowledgement. The steadiness was something she'd earned the hard way, and tonight it had been useful, and that was what it was for. Setti came to the sink beside her. He was a quiet man, and he stayed quiet for a moment before he said, "You were in the military." It wasn't a question. "Yes," Elena said. He nodded. He ran his own water. "My brother was a corpsman. 3 tours. He didn't elaborate and she didn't ask him to. He dried his hands and left." Elena dried her hands. She went back out into the corridor where the clock on the wall said 3:47 a.m., and where the only person waiting was General Raymond Stokes, still in his dress uniform, which he'd been in for, she calculated, going on 12 hours at least. He looked at her. "She's going to be fine," Elena said. "The surgical team closed the secondary bleed. Dr. Hargrove will come speak with you directly, but her pressure is stabilizing and there were no neurological events." Stokes absorbed this. He sat down slowly, in the particular way of someone whose body has been running on will and is now being permitted to acknowledge what that costs. He put his hands on his knees. He looked at the floor for a moment. Then he looked up. "You were in there?" "Yes." "How?" Dr. Hargrove made a clinical decision. She paused. "I assisted in an observational capacity." He looked at her with the expression of a man who understood precisely what she was doing with language and was choosing not to make her say it more plainly. "All right," he said. They sat in silence for a moment. Down the corridor, a monitor chirped and was answered. The building was doing its nighttime things around them, unhurried. "You need to sleep," Stokes said. "So do you." "I will when she's in recovery." He looked at the wall across from him. You should go home, Ms. Marsh. What you've done tonight, you're done. Let the rest of it happen without you standing in a hospital corridor. Elena understood what he meant. There was a machinery now that had been set in motion. Tatum's inquiry. The records Foss couldn't unpull. The documentation Elena had handed over. And that machinery was going to move whether Elena was present for it or not. She'd done what she could do. The next phase wasn't hers to manage. Okay, she said. Get a lawyer, he said. Today, when offices open. I was told. I know you were told. I'm telling you again. He paused. Because what Major Tatum has is significant, and the people on the other side of this are going to have legal representation by 8 this morning, and you should not be in a position where you're the only person in the room without it. Elena nodded. She stood. She picked up her bag from the chair where she'd left it, still packed from the locker room 12 hours ago, the whole day folded into a single zip compartment. General, she said, I'm glad she's going to be okay. He looked up at her from the chair, and his expression was the kind that happened when professional composure and something more personal occupied the same face at the same time, and neither one fully won. So am I, he said. Ms. Marsh, thank you. She walked out at 3:52 a.m. Mom odd. She slept 4 hours. It wasn't enough, and it was what there was. She woke up at 8:10, made coffee that was better than the hospital's, and sat at her kitchen table with her phone and searched for employment attorneys in Silver Bend. There were 3 practices. She called the one that had the clearest language about medical employment cases on their website, left a message, and within 20 minutes had a call back from a woman named Laurel Osei, who asked 6 precise questions in the first 3 minutes and then said, Don't talk to anyone from the hospital or their legal team without me on the line. I'll be available from 10. That was the first thing that felt, in a modest but specific way, like solid ground. The second thing was Danny's text at 9:30. You need to see the news. The third thing was the news. Elena didn't know who had leaked it. She didn't know if it had been one of Stokes's people, or someone on the hospital staff, or simply the unavoidable outcome of a military convoy arriving at a hospital in a town of 80,000 people and a JAG officer spending 3 hours in the records room. Probably all 3, in the way that things became public. Not one leak, but a slow accumulation of them, each individually small, until the structure they were all flowing around became visible. The story was on the regional news site by 9 a.m. and on 2 national outlets by noon. It was incomplete and it had errors. The timelines were slightly off. The characterization of Elena's role was vague in ways that were sometimes flattering and sometimes not. But the shape of it was correct. A nurse at Harlow General Hospital had been suspended the same day she identified a life-threatening injury in a 14-year-old patient, and that same night had been instrumental in identifying critical complications in the daughter of a senior military officer, while suspended from a parking lot, and the hospital was under federal inquiry. The comments section of the regional news site had 340 posts by noon, and Elena refused to read them. Patricia Glover called at 11:15. Elena let it go to voicemail. The voicemail said, in Patricia's careful administrator's voice, that the hospital would like to schedule a conversation to discuss the current situation and Elena's employment status, and that there was no need for this to become adversarial, and that Harlow General valued its nursing staff. Elena sent the voicemail to Laurel Osei. Osei called back at 11:22. Don't respond. Let me make that call. Okay. And Elena, you've talked to news outlets? No. Keep it that way. For right now, specifically. The inquiry makes everything more complicated if you're in the press. Elena understood. The board meeting happened on the 3rd day. She wasn't there. Osei had confirmed there was a special session, had gotten confirmation of the agenda items, but Elena herself had no standing to attend a hospital board meeting about an employment matter that was also now an active federal inquiry. She sat in Osei's office while it happened, a spare functional space in a building 3 blocks from the hospital, and drank coffee and watched Osei work her phone. What came out afterward arrived in pieces, reported back by Osei through sources that Elena didn't ask about. Gerald Foss had presented a prepared statement. He had characterized the events of the previous 48 hours as a series of regrettable miscommunications, had acknowledged that Elena's clinical concerns had proven accurate, and had proposed a review of the hospital's nurse-physician communication protocols. He had not used the word suppression. He had not used the word wrongful. He had not addressed the Webb file, or the Fitch file, or the 5 other documented incidents sitting in Major Tatum's tablet. The board had questions, not the gentle, administrative questions of an oversight body going through motions. Real questions, the kind that happen when a board of directors looked at the liability implications of a federal inquiry, a national news story, and 8 documented incidents of suppressed clinical concerns, and understood that the person who had been managing the situation for them had failed, significantly, to protect the institution. The questions had lasted 3 hours. Foss had left the meeting and gone directly to his office and not emerged. By 5 p.m., Yosei received a call from the hospital's legal counsel, the woman in the dark blazer, whose name turned out to be Sylvia Marsh, another coincidence this situation apparently required, informing her that the hospital was prepared to discuss terms of reinstatement for Elena and requesting that all parties consider an expedited resolution. Osei said they would consider it on their timeline. Mumbit. Calloway was quieter. That was the word Elena kept getting back. Quiet. He'd come in for his scheduled shift on the second day and worked it without incident, but the charge nurses said there was something different in how he moved through the department. The specific confidence that had always defined him in the ER, the absolute certainty of a man who never needed to second-guess himself, had changed frequency somehow. He was still competent. He was still fast. But he kept checking things twice that he'd never checked twice before. Elena heard this from Danny, who was constitutionally incapable of not reporting things she'd observed. "Is he asking questions?" Elena said. "About what?" "About anything. The cases. The inquiry." He asked Dr. Okonkwo what she'd been interviewed about. Danny paused. She told him that was between her and the investigators. Elena thought about that. Calloway was not a stupid man. He knew by now that the inquiry covered more than one night. He knew it covered the Fitch case and the Webb case and the pattern of suppressed escalations. He knew his name was in those files. The question of whether he'd participated in the suppression or simply benefited from an environment that made suppression easy was not Elena's to answer. That was Tatum's work. But the question existed, and Calloway knew it existed, and that was its own kind of consequence. Not the formal one, not yet, but the daily weight of knowing that something you did or didn't do was being looked at by people with subpoena authority. Elena wasn't satisfied by it exactly. She wasn't sure what she'd expected satisfaction to feel like, and when she reached for it, it wasn't quite there. Just the particular quietness of a thing that had been moving underground for a long time and had finally come to the surface. On the 4th day, Tatum called her directly. "I'm not able to give you detailed information about an active inquiry," she said, "but I can tell you that the documentation you provided has been verified and incorporated, and that the scope has expanded beyond the original parameters." "Expanded how?" "I can't specify, but I want you to know that what you gave us was not a peripheral piece of this. It was central." Elena was at her kitchen table. Outside the window, the dry cleaner's parking lot was doing its ordinary things. A car pulling in, someone dropping off a coat, the small transactions of a regular Tuesday afternoon. "Okay," she said. "One more thing. The general asked me to pass something along." A pause. "He said you'd know what it meant. The Fitch case is being reviewed by an independent medical audit, not just the federal inquiry. Someone outside the hospital requested it." Elena sat very still. Harold Fitch, the 61-year-old man who'd been discharged and readmitted 40 hours later with a subdural hematoma. The first case she'd filed a concern about, the first one that had disappeared. An independent medical audit meant someone was looking at whether the care he'd received met standard of practice. It meant questions would be asked that the hospital's internal review had made sure weren't asked. It meant that if the answer was what Elena had always believed the answer was, there would be consequences with a different character than an employment dispute. She thought about Harold Fitch. She didn't know where he was now, whether he'd fully recovered from the neuro rehab, whether the 6 weeks had left lasting effects.
whether he knew that the nurse who'd flagged his injury had spent the following year being written up for it. Probably he didn't know. Probably he'd gone home and rebuilt his life. And she was just a moment he didn't fully remember because he'd been confused and in pain, and then suddenly much worse. That was okay. That wasn't why she'd filed the concern. "Thank you," Elena said. "Ms. Marsh," Tatum said, "take care of yourself."
The board's formal decision came on the 6th day. Gerald Foss was placed on administrative leave pending the outcome of the federal inquiry and an internal audit of his record management practices. The board statement, which Osei forwarded to Elena with a brief annotation reading, read the third paragraph. Noted that the audit had identified irregularities in the documentation and retention of internal quality review submissions over the preceding 18-month period. Irregularities. The careful institutional word for removed. The third paragraph of the board statement said that Elena Marsh's suspension was being formally rescinded, that her employment record would be corrected to reflect the rescission, and that the board had commissioned an independent review of Harlow General's clinical escalation protocols to begin within 30 days. It did not say they were sorry. It did not say she had been right. Institutional statements rarely said either of those things directly. They said everything around them and left the actual acknowledgement to be inferred. Elena read it twice and set her phone down. Osei called 10 minutes later. "That's the board. That's not the full resolution. We still have the wrongful suspension claim and the question of back pay and potentially a larger settlement depending on the Fitch audit outcome. But that statement is public, Elena. That's in the record now." "I know. How are you doing?" Elena considered the question with the honesty it deserved. "Tired," she said, "and something. Not quite what I expected." "What did you expect?" She thought about it. Something that felt more finished. Osei was quiet for a moment. "These things don't finish all at once. They finish in layers." She paused. "But you should know what that statement says about the rescission, about the protocol review. That didn't happen because the board had a change of heart. That happened because you documented everything for 14 months and you handed it to the right person on the right night, and then a 4-star general took an interest." "I know. Most people in your position, they stop documenting after the first 2 or 3 times it goes nowhere. They stop because it's demoralizing and it costs them energy they need for everything else." Osei's voice was measured and precise. "You didn't stop. That matters. In the end, that's what made all of this possible." Elena stood by the window, the parking lot, the dry cleaner, a woman loading a garment bag into the back of a station wagon. She hadn't stopped because stopping hadn't been an option she could find in herself. It wasn't heroism, it was closer to a constitutional inability to let things go that she could see clearly were wrong. She'd been told, at various points in her life, that this quality was a problem. In certain environments it had cost her. In this one, apparently, it had changed the architecture of something. "What's next?" she said. "Calloway," Osei said, and Elena could hear her attorney's voice shift into a different register, sharper, more focused. "The board statement is careful about him. He's named in the inquiry documentation but not in the board's public communication, which means either they're protecting him or the inquiry is still building its picture, or both." She paused. "Tatum called me this morning, off the record." Elena waited. "Calloway filed his own complaint," Osei said, "against you, yesterday, after the board statement." Elena was still. "He's claiming that your entry into the OR on the 3rd night constituted unauthorized practice of medicine, that Hargrove allowed an unqualified individual to participate in a surgical procedure, that any outcome claims related to your involvement that night are overstated, and that your presence potentially compromised the sterile field." Elena's hand had tightened on the phone without her meaning it to. "He filed it with the state nursing board," Osei continued, "and copied the hospital's legal team. And, Elena, he also filed a secondary complaint alleging that your documentation of clinical concerns over the past 14 months constitutes a pattern of harassment directed at attending physicians." The word harassment landed with a specific weight. She had expected something. She'd understood on some level that a man with Calloway's pride and Calloway's history didn't simply watch an inquiry build around him and stay still. But this specific move, this particular reframing of 14 months of careful, documented, factual clinical concern filing as a campaign directed at him personally, this was something she hadn't anticipated in quite this form. "He knows," Elena said quietly, "that the nursing board complaint will freeze my reinstatement." "Yes," Osei said. "While a complaint is under review, Harlow General can defer acting on the board's reinstatement decision without technically violating it. He's not stupid." "No," Elena said. "He's not." Tatum says the inquiry team is aware of the complaint. She said, and this is still off the record, that the timing and framing of it are noted. Elena pressed her free hand flat against the window glass. The cold came through it, that specific November cold of a Pacific Northwest morning that never fully left the glass even when the heat was on. "He's trying to make this about me personally," she said. "Not about the cases. About me. Yes. If that complaint gets traction, it won't," Osei said, with a certainty that was professional but not absolute. "The documentation is too clean and the pattern is too clear, but it will take time, and it will cost you." A pause. "And Elena, there's one more thing. His complaint references a specific case. One he says demonstrates that your clinical judgment is unreliable. He's citing a case from 11 months ago, a patient named Daniel Purcell. He's saying you flagged an unnecessary concern, caused undue patient anxiety, and that the patient subsequently filed a grievance against the hospital." Elena went very still. Daniel Purcell. She remembered him. 44 years old, abdominal pain presented as gallbladder. Calloway had assessed it as a standard gallstone case. She'd flagged a concern about the presentation, something in the pattern of symptoms that hadn't fit neatly. She'd been overruled. The patient had gone to surgery and come out fine. Calloway's position was that she'd been wrong, that the outcome, the fine, uncomplicated surgery, proved her concern had been unnecessary. But the patient's grievance, she hadn't known about a grievance. "What grievance?" she said. "What did Purcell file?" Osei's voice was careful. According to Calloway's complaint, Purcell filed a grievance stating that a nursing staff member had caused him significant anxiety by suggesting he might have a more serious condition than the physician believed. He cited it as evidence of a pattern of you overstepping. "Now, I've never seen that grievance." "I know. It was never shared with me." "I know that too." Osei paused, and there was something specific in the pause. Which is interesting, because if a patient files a grievance naming a staff member, that staff member is supposed to be notified and given the opportunity to respond. Elena understood. "It wasn't in my file. It's not in the file Tatum pulled, which means either it was filed somewhere Tatum hasn't looked yet, or it was filed recently, as in very recently, as in possibly in the past 6 days recently, or..." Osei stopped. "Or it doesn't exist," Elena said. "I'm not saying that yet." "But you're thinking it." The silence lasted exactly long enough to be an answer. "I'm not saying that yet," Osei repeated. "But I'm going to find out. And Elena, if that grievance was fabricated or backdated, that's not a complaint against you anymore. That's obstruction of a federal inquiry." Elena let that sit for a moment. She thought about Calloway, not with anger exactly, because anger required a kind of energy she didn't have left for him, but with something colder and more precise. The recognition of a man who had spent 15 years in an environment that had never made him face a real consequence, and who was now cornered doing what people like that did when they felt the walls closing. They didn't take responsibility. They constructed a different story and hoped it moved faster than the truth. "What do I do?" she said. "Nothing," Osei said. "You let me work. You don't speak to Calloway. You don't speak to the hospital. You don't speak to the press. You go about your week and you let the process run." A pause. "Can you do that?" "Yes," Elena said. She hung up. She stood at the window. She counted to 10 the way she'd been taught to count in a different life, slow and deliberate, in environments where reacting before you'd finished counting had consequences you couldn't take back. Then she went and made more coffee, and she sat down, and she waited for the truth to do what it did when someone had been careful enough and patient enough to document it properly. She had been both of those things. For 14 months. She had been both of those things when it cost her, and when it exhausted her, and when it felt like sending letters into a void. And now the void had opened up, and everything she'd sent into it was coming back. Money. The Daniel Purcell grievance did not exist. Osei confirmed it 9 days after Calloway filed his complaint. Not a filing that had been lost or misfiled or processed through the wrong channel. Not in the hospital system, not with the state patient advocacy office, not anywhere in the paper trail that should have contained it if it was real. Purcell himself, contacted by a legal investigator working for Osei's firm, said he had no recollection of filing any grievance and had in fact left his appointment that day with significant appreciation for the nursing staff who had made sure his questions were answered. He said the only complaint he'd ever considered making was that the surgeon had seemed rushed, and he'd never filed it because he hadn't wanted to cause trouble. The document Calloway's complaint had cited, a one-page internal grievance summary bearing a patient file number and a date 11 months prior, was examined by a records specialist retained by Tatum's office. The metadata in the hospital's document management system placed its creation date at 6 days before Calloway filed his complaint. The file number corresponded to Purcell's actual file, but the grievance itself had been added to that file 6 days ago. Someone had created it and backdated it and inserted it into a real patient file. Elena was in Osei's office when Osei got the confirmation. She watched her attorney's face do the thing that legal faces do when evidence arrives that is simultaneously exactly what you expected, and still, somehow, worse than you'd made yourself believe it would be. "It's obstruction," Osei said quietly. "It's fabrication of a medical record. It's potentially fraud." She set her phone down on the desk with the careful placement of someone handling something fragile. "Tatum has the forensic documentation." She moved fast. "Does Calloway know they've confirmed it?" "He will." Osei looked at her. "Elena, I want to be very direct with you about what happens next. This is no longer a nursing board complaint. This is no longer an employment dispute. What Stephen Calloway did, creating a document to undermine a federal inquiry and insert it into a patient's medical record, that's criminal exposure. The federal side moves first, and then the state medical board. And then there will be civil exposure on top of that." She paused. "He's done." Elena looked at the wall behind Osei's desk. There was a framed law school diploma and a photograph of a mountain she didn't recognize and a small potted plant that was slightly too close to the window and was probably getting too much direct sun. She focused on these ordinary things while she assembled what she felt about "he's done." Not satisfaction, not the clean vindication she'd once, early on, imagined feeling when something like this resolved. Something more complicated. The weight of knowing that a person's career, regardless of what they'd done, was a real thing, and that the ending of it was also a real thing, and that being right about someone didn't mean the consequences of their wrongness were easy to sit with. She was right about Calloway. She had been right about him from the beginning, not in the way of personal dislike, but in the clinical, observational sense. She'd seen what he was, the shape of his judgment, where his pride operated and where it failed. And he had made every choice that led to this moment freely, with full knowledge of what he was doing. That didn't make it simple. "Okay," she said. "I'm at time." The state medical board moved within 3 weeks of the forensic confirmation. The process was not public in the way that news articles were public, but its existence was. And when the notification appeared on the medical board's case registry website, it had the particular institutional language that meant something serious. Formal complaint filed, hearing scheduled, temporary practice restriction pending outcome. Temporary practice restriction meant Calloway was not treating patients while the board completed its review. In practical terms, it meant he had left the ER at Harlow General and would not be back. And whether he was ever back anywhere was now a question for a hearing panel rather than an employer. The story that had been on the regional news site 6 days after the initial events grew into something larger. Not sensational, not the kind of story that ran on 24-hour cable, but the kind that ran in medical trade publications and nursing advocacy newsletters, and was shared in the forums where healthcare workers talked to each other about things they couldn't always say out loud at work. It was shared with the specific intensity of people who recognized something. Nurses who'd been told they were overstepping. Nurses who'd documented concerns that disappeared. Nurses who'd been written up for asking the same question twice. They shared the story and they said, "This is what it looks like, and this is what it costs." And sometimes they said, "I have a file like that, and I never sent it anywhere." And that was the sentence that stayed with Elena when Danny told her about it, because that sentence was the real shape of the thing. Not her story specifically, but the pattern her story had put a name to. Gerald Foss resigned his administrative position on a Thursday, 22 days after his administrative leave began. His resignation statement cited personal reasons and a desire to pursue other opportunities, which was the kind of language that said everything by saying nothing. The board accepted it and announced an interim administrator within 48 hours, a woman named Dr. Patricia Anand, who had a background in hospital quality management and whose first public statement included the phrase, "Patient safety requires that every clinical voice be heard and documented with accountability," which was not subtle and was not meant to be. Elena read both statements at her kitchen table. She was on her third week of not being at work. She had learned, in this period, that she was not good at extended inactivity. She had too many years of operating on structure. An absence of structure made her restless in ways that weren't useful. She'd been going on long runs in the morning, which helped. She'd been cooking properly for the first time in months, which helped. She'd been talking to Ose almost daily, which was useful but not restorative. What she hadn't done was think clearly about what came next. Cassidy Stokes called her on the 25th day. Elena had not expected that. She'd known Cassidy had been discharged, Danny had told her, 10 days after the surgery, and she'd known, in the abstract way of someone who had helped save a person's life and then removed herself from their situation, that Cassidy was recovering. She had not anticipated a direct call, and she sat with her phone in her hand for one ring longer than was probably polite before she answered. "Ms. Marsh." Cassidy's voice was young and direct and had the specific energy of someone who had been through something serious and had come out of it with a determination to be more direct about things than she'd been before. "I've been trying to get your number for 2 weeks. My dad kept saying to give you space. He was right. He usually is. It's annoying." A pause. "I wanted to say thank you. I know that's inadequate. I know that you were standing in a parking lot reading my vital signs through a window, which is, that's a thing that happened, and I would have been dead without it. Probably. They told me probably." She stopped. "I don't know how to say thank you for probably." Elena looked out the window. "You don't have to." "I do, though." Cassidy's voice was quieter now. "I'm in school. Pre-med, 2nd year. I want to be an emergency physician. And I keep thinking about the whole thing, everything my dad told me about that night. And I keep thinking about the fact that you were right twice in one night and nobody in that hospital let you through the door." Elena was quiet. "Is that what medicine is actually like?" Cassidy said. "Is that what I'm going into?" It was a real question. It deserved a real answer. "Some of it," Elena said. "The hierarchy is real and it has good reasons behind parts of it and bad ones behind others. And learning to navigate it is part of the job. But," she stopped. "The most dangerous thing in a hospital isn't a complicated diagnosis. It's an environment where people are afraid to say what they see. And you can be the kind of doctor who makes that better or worse, and that choice is more important than how good you are technically." Cassidy was quiet for a moment. "My dad said almost the same thing. He's been in environments where it matters. It shapes how you think about it." "What made you stay?" Cassidy said. "All those times they pushed you out. What made you keep filing the complaints, keep flagging things?" Elena thought about it. Not the answer she'd give if she were managing the conversation, but the true one. "I kept seeing patients," she said finally. "I kept seeing the specific person in the specific bed, and I couldn't unfocus from that. The politics and the hierarchy, those are systems, and systems have their own logic. But the person is just a person. They came in because something's wrong. That's all they know. Everything else, who has authority, what the protocol says, what it's going to cost me to speak, that's background. The person in the bed is the foreground. I couldn't make it the other way around. Cassidy didn't say anything for a moment. Okay, she said eventually. I'm going to try to remember that. You'll forget it sometimes, Elena said. Everyone does. The system is designed in ways that make you forget it. That's not your failure. It's just the reality. The thing is to keep finding your way back to it. Cassidy made a sound that was part laugh and part something more serious. You're different than I expected.
From the story, I mean. The way my dad told it, I thought you'd be more what? I don't know. Dramatic about it. Elena almost smiled. I was standing in a parking lot reading vital signs through glass at 11 at night. That's not a story. That's just what the situation required. My dad says that's what courage looks like, Cassidy said. Not the version in movies. The version where you just keep doing the thing that needs to be done even when it's costing you. Elena looked at the table. Her coffee was cold. The parking lot outside was doing its ordinary afternoon things. Tell him I said he raised a good one, Elena said. He'll say he had help, Cassidy said. From her mother. A brief pause, not sad exactly, but waited. Anyway, thank you, for real. Take care of yourself, Elena said, and take care of your patients. She hung up and sat still for a moment, with the conversation settling around her like weather, and she felt something shift that was quieter than resolution, but more durable. The specific feeling of having done something that connected to something larger than the moment it happened in. The formal reinstatement offer came on the 31st day. It came in the form of a 12-page letter from Harlow General's interim administrator, Dr. Patricia Anand, with OSE's annotations in the margins and a cover note from OSE that said, recommend acceptance with modifications to sections 4, 7, and 9. Call me. Elena read it twice. She called OSE. Section 4 concerned back pay, full compensation for the period of suspension, which had extended into what was now legally a wrongful termination situation given the fabricated grievance documentation. OSE had pushed for the full amount and gotten it, plus a standard adjustment for legal costs. Section 7 concerned title and role. Harlow General was not simply offering Elena's old position back. They were offering something new, a position that had not previously existed at the hospital, titled Clinical Safety Liaison, which sat outside the direct physician-nurse hierarchy and carried a specific mandate to receive, document, and escalate clinical concerns from nursing staff to the medical board level, with a protected reporting structure that bypassed the unit administrator chain. The position had been created, according to the letter, as a direct outcome of the protocol review commissioned by the board. Section 9 concerned the nursing board complaint Callaway had filed, which had been formally withdrawn following the confirmation of the fabricated grievance documentation, and which Harlow General was committing to note as unfounded in their communications to the board. Elena read Section 7 3 times. A protected reporting structure, she said. They can't undo what happened, OSE said, but they can build a system that makes it harder for it to happen the same way again. The board pushed for this. Anand pushed for this. And frankly, Tatum pushed for this. She made it clear that the inquiry's findings were going to recommend structural reform regardless, and that a hospital that got ahead of those recommendations would be in a better position than one that didn't. Who reports to me in this role? You report to the medical board directly, not to hospital administration. You have standing to escalate any documented clinical concern from any nursing staff member at any level. You can't be disciplined for doing it without board review. Elena sat with that. The specific architecture of it, the thing she'd been doing for 14 months informally, without protection, at personal cost, now built into the structure of the institution. Not because the institution had wanted to do it, but because the weight of consequence had made it necessary. That was how systems changed, not through goodwill, but through the accumulation of evidence that the alternative was unsustainable. She knew that. She'd always known that. She just hadn't been sure she'd be around to see it. The modifications to Section 4 are standard, she said. Boilerplate, OSE said. They'll accept them. Then tell them yes. She went back to Harlow General on a Tuesday morning at the end of November, which was an ordinary choice only because Elena had deliberately made it ordinary. She'd driven herself, she'd parked in the regular lot, she'd walked through the main entrance rather than the ER bay. She had a new badge, which Harlow General's HR department had issued with a specificity she appreciated. Her name, her title, a clearance code that opened every door in the building. The ER was running when she passed it on the way to her new office, which was not a repurposed supply closet or a desk in a corner, but an actual room, small, with a window that faced the hospital's interior courtyard, and a desk that was largely empty, and a whiteboard that someone had written "Welcome Back" on in blue marker. She stood in the doorway and looked at it. She didn't feel what she'd expected to feel, which was some version of triumph, the internal equivalent of a flag being planted. She felt quieter than that. She felt the specific, unglamorous satisfaction of a very long project arriving at a point where the work was going to change form, but not stop. She had a meeting with Anand at 10. She had a meeting with the Nursing Staff Liaison Committee at 2. She had a stack of documentation protocols to review and a reporting system to help design from the ground up, because the system didn't exist yet and building it was now her job. She sat down at the desk. She thought about Harold Fitch, who had survived his subdural hematoma and, according to the independent medical audit that had been completed 2 weeks ago, had experienced a delay in diagnosis that met the threshold of preventable harm. The audit's findings had been referred to the State Medical Licensing Board. The attending whose discharge decision had preceded Fitch's deterioration was Dr. Stephen Calloway, and that finding was now part of the medical board hearing that was scheduled for February, and that Elena would not attend, but whose outcome she would learn through OSE with the same quiet, necessary attention she'd paid to every other part of this. She thought about Tyler Oakes, who was somewhere in Silver Bend doing 14-year-old things. Going to school, growing into his ears, living a life he'd nearly lost in a hospital waiting room because his BP numbers told a story a doctor didn't want to read. She thought about Danny, who had come to find her in the ICU at 1 a.m. because something felt wrong and she needed someone who could look at it clearly, and who had texted her this morning. "You better not have a complicated coffee order in that new office. I'm not walking that far." She thought about the parking lot, the glass, the vital signs she'd read from 40 feet away in the dark. She thought about Cassidy Stokes, who was back in her second year of pre-med, probably in a lecture hall right now, probably with a notebook full of things she was going to carry into a career that would ask her someday to choose between what was easy and what was necessary. Elena hoped she'd choose right. She hoped the weight of that choice would feel familiar by then, not frightening. The kind of familiar that meant you'd done it enough times that you understood it was survivable. She opened her laptop. She started a new document. She titled it Clinical Concern Intake, Protocol Draft Version 1. Then she stopped. She opened a different document, a blank one. She typed a different heading, what this office is for, not for the protocol manual, not for HR, just for herself. The way soldiers sometimes wrote things at the beginning of a deployment to remind themselves of what they were doing when the middle of it made everything unclear. She wrote, "This office exists because people got hurt who didn't have to get hurt, and because the people who saw it coming were systematically prevented from saying so. It exists because a 61-year-old man spent 6 weeks in neuro rehab for a bleed that a doctor dismissed, and because a woman coded in a parking lot, and because a 14-year-old boy almost went home to die. It exists because none of those people knew to be afraid of the thing that was about to happen to them, and the only people who could have protected them were the ones who were told to be quiet. This office is for the nurses who see something and don't know if anyone will listen. It's for the moment between seeing and speaking, which is the most dangerous moment in medicine. Not the diagnosis, not the treatment, but that moment when someone has the information that could change everything and doesn't know if it's safe to say it out loud. My job is to make that moment less dangerous. That's all. That's everything." She looked at what she'd written. Then she closed that document, saved it where no one but her would find it, and opened the protocol draft again. She had work to do. Stephen Calloway's medical board hearing concluded in February. The panel deliberated for 2 days, the fabricated grievance, the suppressed clinical concerns,
The Fitch finding, the pattern of documentation that Elena's 14 months of careful record-keeping had made impossible to dispute, and delivered a formal censure and a 2-year probationary license restriction, the conditions of which included mandatory supervision of all clinical decisions, required reporting to the board on a quarterly basis, and a prohibition from serving in any supervisory or administrative capacity. It was not a revocation. Elena had known it might not be. Medical boards were conservative in their penalties, and Calloway had no prior formal disciplinary record, which the panel weighted. Osei had prepared her for that possibility, and Elena had sat with it and decided, in the way she made most decisions now, that the alternative to imperfect justice was not the perfect version. It was no justice at all, and that imperfect was still real. He would practice medicine under supervision, every clinical decision reviewed, every quarter his record examined by people who now knew exactly who they were examining. He would spend the next 2 years inside the very accountability structure he'd spent 15 years operating without. That was its own kind of consequence, one that would be with him every day he was in a clinical space. She heard about the hearing outcome from Osei. She acknowledged it. She went back to the protocol document she was building. Gerald Foss's situation moved more slowly and resolved less cleanly. An employment arbitration that settled out of public view, a non-disparagement clause that meant he couldn't talk about what had happened, and the hospital couldn't talk about the terms, and a provision that barred him from administrative positions in healthcare for 5 years. Osei said it was less than the situation warranted and more than most institutions would have agreed to, which was the exact arithmetic of institutional accountability. Elena filed that away and didn't spend energy on it. In March, 4 months after she'd walked back into Harlow General with a new badge and a blank whiteboard, Elena's clinical concern intake system processed its 37th formal submission. It came from a night shift nurse on the surgical floor, a woman named Petra Wolf, who had been at Harlow General for 7 years and who, in her submission, noted with careful precision that she had previously flagged a similar concern informally through the old protocol and received no response. She'd flagged it again through Elena's system. Elena read it at 7 a.m. and had it in front of the right physician by 8:15 a.m. and in the patient's chart by 9 a.m. The patient did not need emergency intervention. The concern was valid. The situation was addressed. The outcome was unremarkable in the best possible way. A concern was heard, a patient was looked at more carefully, and a potential complication was managed before it became a crisis. Petra Wolf sent Elena a message at 10 a.m. that said, "Thank you for taking it seriously," and that was it, 7 words. But Elena read them and understood what they meant, which was not just thank you for this specific thing, but thank you for the system, for the structure, for the decision that what nurses see matters enough to be built into the architecture of how a hospital works. She wrote back, "That's why we're here." On a Thursday in late March, Elena was eating lunch at her desk when her door opened and Danny leaned in with the expression of someone delivering information she's decided not to filter. "There's a woman in the ER waiting room," Danny said. "She says she doesn't have an appointment and she doesn't know if this is the right place to come, but she heard there was someone at this hospital who listened to nurses." Elena looked up from her lunch. "She's a home health nurse," Danny said. "She's been flagging a concern about a patient's medication protocol for 3 months, and the supervising physician keeps dismissing it. She drove 40 minutes to come here." Elena thought about that for a moment. A home health nurse outside Harlow General System, technically outside Elena's jurisdiction, who had driven 40 minutes because she'd run out of other options. She thought about the parking lot. She thought about the glass. She thought about what it felt like to have something important to say and nowhere to say it that felt safe. "Bring her up," Elena said. She pushed her lunch aside. She opened a new intake form on her computer. She put the date at the top and a line for the nurse's name and the patient's situation. And she waited for the person who had driven 40 minutes because someone told her someone here would listen. The chair across Elena's desk was empty. In 30 seconds, it wouldn't be. There were 100 stories that looked exactly like this one, people with information that mattered, standing at the edge of systems that were designed to absorb their voices without amplifying them, making the calculation about whether it was worth the cost to speak.
Most of them had already paid costs they shouldn't have had to pay.
Most of them had already been told in one way or another that what they were seeing wasn't what they thought they were seeing, that the person with the title knew better, that the protocol was the protocol. Most of them were right anyway. They were right, and they knew they were right, and the only question, the one that echoed through every hospital corridor and every institution that had ever made someone feel small for knowing something true, was whether anyone was going to be there when they finally said it. Elena straightened her chair. She had made a career of being the person who said things that cost her. She had made a career and nearly lost it, and rebuilt it into something with a door that stayed open, and what she understood now that she hadn't fully understood. At the beginning was that the cost had never been the point. The point was the 37th intake form, the 40-minute drive. The nurse who was walking up the hallway right now, about to open a door, not knowing yet that on the other side of it was someone who already understood exactly what it had taken to come this far. The footsteps stopped outside. A knock. "Come in," Elena said,